Hi, I'm Fabian. I developed medical cooling, which was first medical ventilators that can cool patients. This is why we call it medical cooling. Then, with user feedback, we added the ECG, defibrillator, and suction pump, as the first feedback by paramedics was that they don't want to carry all the devices to the patient, and especially not back with the patient when they carry the patient. And then we developed it further, did first initial preclinical trials in pigs and in healthy humans, where we could show in healthy humans that we can cool the brain safe and fast. And in pigs, that strokes are way smaller when we cool the brain of a pig. Other teams did similar trials and get similar results, so I think it's a decent trial. And then we figured out nobody's paying to save people in the ambulance, and it cost money. So we generated an additional business model or a new business model where we focused on the ambulance reimbursement, as we also figured out paramedics do not like paperwork at all. And there are still two forms paramedics have to fill out, one for reimbursement, one for medical records. It's almost the same in any country, and this is a chance to get it on a federal level, because without it, it's district by district. It's not even on a state level, and that's the same no matter if you're in Germany, if you're in mainland China, Taiwan, it's the USA, it's the same, Netherlands. We got through many nations and we figured out it's all really regional. But the digitalization and the change in the reimbursement might be federal. So this is one opportunity to get it on a federal level. And so far, we managed to get 1.5 million euros. I had to put in 300,000 to keep the project alive. It's actually a little bit more, another 300,000 by the industry. It's 1.5 million euros were only grants. So we have around 2 million invested. We still need 3 million more that we get a CE certified product. We won some awards. I was the first German in Startup Talents Taipei. A couple of weeks ago, we won the second prize at the Hospital Procurement Association Summit in Germany, which was a special honor because my solution is mainly focused on ambulances, and we see some use case, especially in the hospital, as long as the patient is moved around from the ER until the ICU, so all the way ER, cath lab, and then in the ICU they can shift to existing cooling solutions. So far, only 23% in the German hospitals that could be cooled or should be cooled are getting the treatment they should get. So the cooling, even in the ICU, should be standard of care, but it's not implemented anywhere, and it should be used in the ambulance. But as far as I know, it's hardly ever the case, no matter where you look at the world. So we still think we should go this path. We know it takes time, we know it takes money, we know we will need another 2 years until we get on the market. We've spoken to initially to the FDA, directly to them. We didn't file the pre-summit yet because then we are in the process where we need to be answering in a certain time, which we are not really able to do because so far I had to cut out all of my team, and even I cannot do it full time anymore because actually the company is not too good on its bank account right now. We're still stable and will manage to exist, but we're not in the stage to hire staff or to make any jumps, and we would really need your help to get to the next step. We've got the technology fully working, and within the Mass Challenge program, we hope to close the funds to finally get through CE and FDA. We hope that we get prototypes that are not only functional but also looking nice, like the final product, and are functional. And hopefully, we get first initial feedback by the FDA, and maybe we even make it through, become a breakthrough device. Who knows? We're not that sure if we go 510K as a ventilator or breakthrough device path. We will definitely need some advice, and we need a decent board that helps us to become a successful company. So we really hope for your support and to get to the next stage with the project, because it can save one life a minute, around one life every 15 minutes in the US, will be one life an hour in Germany. it would be around 4 to 500,000 lives a year in the US, we think. So it's a decent improvement, and because patients with brain damage are really, really expensive, the saving for the healthcare system should be around 4 to 5 billion a year. Calculated was around 40 to 50,000. We did some math around it. I'm happy to send you an Excel sheet and do some calculations with it again. It's definitely in the billions what can be saved because brain damage patients are really expensive, and let's prevent brain damage and stay alive with these people and have a great time.